Hey dental fans, Dr. Rich here. So this video is going to be just one of those quick close-up views of a complete upper immediate denture and a lower cusil partial. But as I was starting to film that, I decided, hey, how about I share with you guys how I go through planning out a case like this, from the day the patient gets to me, we can go over the work that's involved and steps I take to get to the final results. So that's what we're going to do today. So first up, here's a I had a new patient come in, actually a relative of a current patient of mine. Patient's chief complaints were they had some toothaches, they weren't happy with how their teeth looked, and they had trouble chewing. So first step is I take some pictures, see what's going on. As you can see with the pictures, patient had some existing all acrylic partials. So these are the types of partial dentures where it's just the pink plastic, the teeth, and you can in the photo you can see a couple little metal clips to help hold them in. But there's no rest seats, there's no metal framework to give it strength and support. So these types of partials, they're easy to make for people. They're easy to add on to if their teeth are failing. But they're not it's not the easiest to eat with. Aesthetically, there's always some challenges. They're a good interim partial, but not much more than that. So had the patient remove partials, and this is what she had. Basically 5 teeth on top, 2 molars in the upper right in the back, 1 premolar on the upper right. On the left side, she had 1 canine and 1 molar. On the bottom, it was even a little bit worse. She only had 4 teeth on the back. She had a lower left molar, and then that was the only back teeth she had on the bottom. And in the front, she had a canine and 2 incisor teeth that you can see in the photo. So we don't have much to deal with. So the first thing I do is check, all right, well, is there any way we can try to save any teeth, and what teeth can we hold on to? But unfortunately, in the patient's situation, let me pull up a X-ray. She had decay, large fillings on a lot of molars, on her upper teeth, a lot of decay. Periodontally, not horrible, but decay-wise, to try to save those teeth, she would have ended up needing root canals and crowns, and then you end up with kind of a hodgepodge of random teeth in random areas. So while it would be possible, I don't know, she had some toothaches. On the bottom, as you can see, a little worse. Lower front teeth, she did have some decay on a couple of them. And then that lower molar, you don't really see it on the X-ray well, but that was the tooth that was bothering her the most. It was very painful. So basically, after seeing this and the conditions, I always try to give people an option as to try to save as many teeth as we can. And then if not, I usually go down the list of, all right, if we can't save them, then what are our options? So first off, one option is always, all on 4, top and bottom, or some variation thereof of multiple implants and then a bridge on the implants, and that's permanent teeth that don't come out. Second option would be snap-in dentures, basically a few implants on top, 4 implants on top, 2 to 4 implants on the bottom, and then a set of dentures, overdentures that snaps in on top of them. The last option for them would be full upper denture, and then some type of lower partial denture. So presented all the 4 options to the patient and talking about it, and then also due to budget, they decided to go with the option of an immediate upper denture and a what's called a lower cusil denture. I've made a video about it, so if you're unfamiliar with what that is. And that's what we decided to do. So again, getting back to her pre-op condition, because she had those partials, those all acrylic partials that were working with her teeth, I just, first step we did was just we extracted that lower left molar, the one that was the most painful for her. It was really bothering her. And we decided that we're going to do the dentures as immediate dentures. So what that means is we're going to leave her teeth, especially, for the top, we're going to leave all those teeth in, make the denture. Once the denture is finished, then we will have the patient in, extract the teeth, put the denture in that same visit. So person always has teeth. They walk in one day with their teeth and the partials, and then at the end of that visit, they're going home with their new teeth. So that's what we decided to do. So again, first step, I extracted that lower left molar that was causing problems. Visit after that, we're going to use those 3 remaining lower teeth as anchors for the cusil partial denture. So what I did is 2 teeth that needed fillings, we filled them. Actually, this photo I think is after I filled them, so you can see see those teeth. It's the 2 incisors, and that way stabilized those. Also cleaned all 3 of those teeth, got all the plaque and tartar off them, get the gums nice and healthy. Didn't do anything to the upper teeth because they're going to be coming out, and there was no horrible infections or anything like that. None of them were loose enough that I was worried that they would come out in any of the impressions I was going to take. So after we did the fillings, next step, I took some Alginate Impressions, just basically for some study models. And so these models were just the models that we're going to use. And the only thing these were used for is to make custom trays and to take a new impressions. Then these would be the impressions for the final dentures. So again, I've made a video about doing the steps in making an immediate denture. But basically, you take the custom tray, process called border molding it. We figure out where the edges of the dentures are going to be, and then we take the impression with a different material. So here you can see the upper, you can see the 5 teeth in there, and then in the center, the patient actually had a torus on the roof of her mouth. You can see it in the model there a little bit better. It was, it's a decent sized torus, but not horrible. And I figured, again, to save costs, and I don't think it's going to interfere with the final denture. So we're elected just to leave that in place. Worst case, you can always have it removed down the road, and we just reline the denture in that case. All right. So once we got the impressions, then we just proceeded to go to the next step of making the partials. One last thing before I forget, on the lower, another thing I did, I just kind of trimmed down the sides of these teeth just to make it a little bit easier for the cusil denture to fit in between, just to kind of square them all up a little bit so they're not quite as wide as they were when patient first came in. You could kind of see there, just to reduce the undercuts there. It makes it easier to fit the partial. So we, after the impressions, did the bite registration, selected a shade, did a wax try-in. Sorry, I don't have pictures of all that sort of stuff. And patient was happy with how everything looked, and so they came in for the delivery visit. Delivery went very smoothly. The lower partial fit right in with just a tiny bit of adjustment in a couple spots. For the fitting visit too, I used a material called pressure indicating paste. It's just a creamy white stuff that you kind of paint on the inside of the denture, put it in the person's mouth, press down on it, and then any tight spots where the denture is going to be rubbing a lot, it pushes away the paste, and so you know where to adjust it. So I usually do that a few times, and the patient was comfortable. So now we went up to the upper. So that involved extracting the teeth. We numbed her up, and then extracted all the teeth, and then we fit the denture in, and it fit well. I used the pressure indicating paste to check for any sore spots, to try to kind of head off any tight places and where it might cause some trouble. And as you can see on the study model for this particular patient, it's usually there's a little bit of, you can see there's some bony overhangs, especially towards the front and around the canine and the premolar. I didn't do very much alveoloplasty. Once I extracted the teeth, I just using my fingers kind of compressed the bone in those areas to squeeze it back together a little bit to try to minimize the undercuts. I did check it with, as I said, with the pressure indicating paste a few times, relieved those areas where it was rubbing. And then the last step we do, we check the bite, make sure the bite's even side to side. Now, I'm not worried about getting the bite perfect at this point in time because there's going to be a lot of changes going on as the jaw heals after the extractions. So I just want to get it even side to side so the person can chew and kind of get used to wearing it. Send the patient home and have them leave the upper denture in overnight. You want to use the immediate denture kind of as a bandage. Basically, it's going to cover the extraction site. It's going to help them heal a little better. And also, it's going to help decrease the amount of swelling. Any little bit of swelling that is going to happen, it's going to just shape itself basically to the fit of the denture on the inside. I try to tell people to leave them in until I see them the next day. So the next day, person came back in, and let's see, we got that's a after smile, and this is what they look like the next day. So you can see full upper denture, and then on the bottom, you can see that where the cutouts are for the 3 natural teeth, where they fit through, and you can see the gasket that kind of fits around them. That little bit of white stuff you see there, that's just remnants of the pressure indicating paste from because I checked it, the next day for the adjustments. I used pressure indicating paste. Check it again for any pressure spots. Also look visually at the person's gum if there's any sore spots. I believe on the bottom they only had just right in the center where the muscle attachment, the frenulum for the lower lip is. I had to relieve that, so I basically just trimmed away a little bit of the acrylic there so that muscle attachment has room to it. You can see the space up on top there for the upper frenulum, for the upper lip muscle attachment. The upper jaw had a couple bigger sore spots, again, both in one by where the upper canine was up here, and then one over a little bit over in this area by where the undercuts were. So checked it again with pressure indicating paste and marked it and relieved it. Patient was very happy with how it's going. Everything feels good. They are having to relearn how to eat a little bit because now it's a completely different setup than it was when they still had their own teeth. The upper, you don't have quite the same proprioception with just a hunk of plastic as you did when you still had a partial denture with a couple teeth. At least with the lower, with those 3 teeth holding the partial in, that's much more helpful to be able to tell when your teeth are touching and how to chew on it. So last thing I did before they left was just check the bite. And again, things are settling in. There's some swelling. The upper denture is pretty much going to still has to kind of settle in place as it heals. So we just again adjust it just to make sure it's the bite is even side to side. And then from here on out, we're going to see them just as they need it. So I instruct the person, as soon as they feel a sore spot, call me right away. We'll get them in and we'll adjust it to take care of it, because those sore spots will not go away on their own. It's just too tight. The denture's not gonna wear in on its own. The plastic is too hard, so it just needs to be trimmed and ground away a little bit. And they also know that in 6 months we're going to have to do what's called a reline of the upper denture, because where all those teeth were is those areas are going to shrink as those areas heal. So while right now the denture, it has a fairly tight fit, in a few months from now it's going to start getting looser and looser and looser. Person will need to start using denture adhesive to help hold it in, and then usually by about 6 months or so, the shrinkage has kind of gotten, the most shrinkage that's going to happen has happened. So I will do a reline at that point in time, where basically we just add new acrylic to the inside of the denture to get a tighter fit again, once again. And so from here on out, again, the person comes back whenever they need to for an adjustment, and I instruct them to remove the denture every night before they go to sleep. Gotta let give the gums a chance for air to get to them. You don't want to leave the dentures in overnight because stuff can start, plaque will get underneath it and start growing. Could lead to fungal infections, all sorts of great stuff like that. So I always tell people, take your teeth out at night. I mean, you wouldn't want to wear a pair of socks all day, sleep in them all night, wear them all the next day, and on and on and on. So take your dentures out, clean them up, and then give your gums a rest overnight, and then put them in the morning. Hopefully you guys appreciated this little journey, this little case presentation of what I did. Any questions on any of the steps, please leave me a comment down below. Thank you guys so much for watching. I'm going to try to make a couple more of these types of videos, but with better documentation. This one was just kind of an afterthought afterwards, so I will try to do better for the next one. Thank you guys so much for watching. See you next time.